Got a full house today. There are some open chairs at some of these tables here, so if you are standing, please try to find one. Otherwise, the Holiday Inn is setting up some tables over here, so we should have some additional seating available shortly. Let's begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to now invite up Dr. Paul Edmondson, who will facilitate today's invocation.
Well, let me just start by saying, giving an invocation, given the events of the last week, is a monumental ask, but I'll do my best. So please bow your heads. Dear Lord, most importantly, we ask for peace. Peace in the world, peace within our own hearts. Today, we ask especially for prayers for healthcare workers, those on the front lines, anybody who's handling the implications of the global pandemic. We ask for ongoing wisdom to be able to deal with the operational challenges. We thank you for knowledge, for wisdom, to help to fight this and fight it together. Please be with all of us. Keep us safe. Keep our families and friends likewise safe. In your name we pray. Amen.
Bonnie, if you want us. We have some Rotary business that we'll need to get to before we move into our program. But I'd like to start off by asking all of our guests today to please stand and be welcomed. I know we got guests. Thank you for being with us. Okay, for our Rotary business today, I would like to invite up Harley Artlitzer, Innovation Coordinator for the City of Sioux Falls, to talk about some exciting stuff that the city is working on here. So come on up, Allie.
Thank you, and thank you to Alex for inviting us here today. I'm very excited to share with you a project that the city is working on called IDEA, which stands for Inclusive Digital Equity Alliance. Let me make sure I know how my clicker works. Perfect. So I am Allie Hartzler. I lead the innovation division at the city, where we work every day to be a catalyst for the common good by solving problems in new ways, working with our community. And one of those challenges is digital equity. I want to start by sharing a story with you guys. I don't know if you remember that last year was the census year. It feels like it kind of got lost in all the things that happened. But one of the things we tried to do in our office was understand how can we make the census more accessible for the underserved in our community. It's kind of intimidating to fill out a form from the government, especially if you're from a different country. So we did some research. We went down to the transit depot and had some conversations to try to understand what are the barriers that people are facing with taking the census. And if you remember, last year was the first year that the census was ever completely online. We had some really interesting conversations. Two that stood out to me. I was talking with a young girl who was riding the bus home from school, and she was a first-generation American. She didn't speak English super well, but we were able to have a conversation. She was playing a game on her smartphone, and I was asking her if she knew what the census was, how to do it, why it's important. And the thing that stood out to me was that she didn't have any way to access it. So even though she had a smartphone and she was playing games on it, she did not have any data on her plan, and she did not have any internet at home. And that was a thread through many of the conversations that we had. I talked with another woman who was living in a sober house. And at that sober house, she did not have any internet connectivity. So access to the internet is such a critical function of being able to participate in our society, not only for taking things like the census, but this is super, super real, especially in times of COVID, right? How can you find where your nearest food distribution is? How can you apply for, how can you find a testing site nearby if you don't have this? So that's kind of the story, the why behind this work is so important. But we also have some data to help give us some shape. In 2017, the American Community Survey asked people about their access to data and internet at home or on a mobile device. And in Sioux Falls, as of 2017, 15% of households, or approximately 25,000 people, didn't have access to the internet. The map that you're looking at shows census tracts. The darker the color, the greater the need or the greater the lack of access to internet. So we really saw this as a challenge that needed to be tackled. And the only way to do it was together. And I want to just take a step back and quickly share with you a definition of digital equity and what that means. Digital equity is a condition in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. It's a lot of words, but really there's three pieces you need to know that make it work. It's access to the internet, it's access to the device, so a computer, a tablet, a phone that connects to the internet, and it's education. Just because you have the tools doesn't mean you know how to use it. Just a few weeks ago, a young girl that I mentor used her COVID stipend to buy a car, but she asked me for help to figure out how to get her permit. So she was driving this thing around and she didn't know how to get a permit because she didn't know how to use the internet. So these are the stories that keep coming up that we're working together to find a solution for. Thanks to a generous sponsorship from Midco, earlier in 2020, we launched IDEA, which is Inclusive Digital Equity Alliance. So this is a group of community stakeholders, and what we're doing is coming together to put together a strategic plan. This is going to outline some key initiatives that we'll work on over the next 3 to 5 years to improve access to those three stools. So access to the internet, to the technology, and to the education. Midco, of course, is a key partner, but we couldn't do it without a variety of community stakeholders. So we've got folks from the school, folks from higher ed, healthcare, and a variety of community organizations that are super passionate in bringing some great resources and ideas to the table. That was the 10,000-foot overview of the project that we're working on. I'm really excited to come back and share with you the next step, which is a community survey. So we're actually going to send a survey out specific to this project to kind of understand what our specific community needs are and go from there. Okay, are there any questions that you guys have? Excellent. Well, thanks so much for having me.
Allie, thank you for joining us today. The club is focused on advancing important conversations, and this is an important conversation to be had. So, Allie, we look forward to bringing you back sometime in the future when you're ready to present the larger strategic plan, because there's so much to unpack there and you need a little more time. But we wanted to bring this initiative to everybody's attention if you hadn't already heard about it. Before we get into the program, I would like to now ask Alex Ramirez to come up for a second. Sorry, Alex, I'm bombing you with a surprise. Everybody in the Downtown Rotary Club is aware that over the last 4-ish years, we have been streaming our programming to the wider audience through Facebook Live. And over the course of this last year, when COVID took off, we really accelerated those efforts. Think 3D is now our partner in advancing our digital initiatives. But over the last 4 years, It was this gentleman right here, Alex Ramirez, who donated his own time every week to ensure that we were pushing out our content to those that want to watch it on Facebook Live. We would not have been able to be as successful as we've been over the last year if it wouldn't have been for the hard work that Alex Ramirez put forth on behalf of this club for 4 straight and consecutive years. So with that, I would like to, on behalf of the Downtown Rotary Club of Sioux Falls, present Alex Ramirez as is hereby named a Paul Harris Fellow in appreciation of tangible and significant assistance given for the furtherance of better understanding and friendly relations among peoples of the world. Please give Alex a round of applause. Alex. We'll get it later. Alex, I appreciate you and your efforts. Alex sits on our board and is an advocate for the Downtown Rotary Club, no matter if it's on a Monday at board meetings or wherever. He is a champion for the Downtown Rotary Club. So thank you, Alex. I would like to now turn it over to Vaney Hariri. Rotarian Vaney will host a panel discussion today focused on the COVID-19 vaccine, including deployment logistics, prioritization, timeline, trust, and efficacy. Our panelists will be Dr. David Basel, Vice President of Avera Medical Group, Clinical Quality, Kim Malsam-Rysdon, Secretary, South Dakota Department of Health, and Dr. Mike Wilde, Vice President, Medical Officer, Sanford Sioux Falls Region. Vaney, I'll now turn it over to you.
Awesome, thank you. You know, it's interesting, as we did the Pledge of Allegiance, it has a little more gravity today than it has in times past. You know, sometimes we just stand up and we do it. The words rang differently today than they have previously. And one of the things that I'm most proud of in the last period of years, as Jason alluded to, was the decision for this Rotary to engage in conversation, some difficult, some complex, with many levels in it, about things of great consequence. And when I just look out at the room and I think about how many Rotarians are at the intersection of some of these big things that are happening in our community, I think it's so important that we have these conversations, but we also send these conversations out to the world so people can have access to the type of folks that we have here today, and that we can have these difficult conversations in constructive ways to ensure that the words that we just spoke in terms of the Pledge of Allegiance become something that is truly real and felt by every American every single day. And as we talk about this kind of conversation with the world that is so filled with mistrust and cynicism and suspicion and all of those different type of things, it makes something that is nuanced. It makes something that is complex, something that requires trust, like vaccinations, like people's health care, how we distribute them in an equitable and ethical way, so important. And so I think we were lucky enough to have these amazing people join us today so that we can have a conversation to answer some of those questions, hopefully put some of those things to bed that are based in mistruths, and give people the confidence in those who work so tirelessly to keep them well. So thank you all for joining us. We appreciate you for this conversation. One of the reasons why I wanted to moderate this was because of all of the people who were eligible to do it. I was probably the most ignorant about the subject. And I think in that particular case, it probably makes me the best suited, because I want to approach this with curiosity. And so my very first question is, because sometimes I think we gloss over some of the small things that are important for people. What is a vaccine?
Can I start with that?
Go ahead.
So I think this is the most important question, because it helps you answer so many of the other questions about safety and efficacy and all of those sorts of things. And so a vaccine is really just something that you're giving the body to kind of prime them and to get them prepared to face an actual infection. Starts way back with smallpox when they realized that milkmaids didn't get smallpox, and they realized that cowpox was close enough to smallpox to protect, and so they started injecting the fluid from smallpox. And then we went to other live virus vaccines like oral polio, and then measles, mumps, and rubella. And then we got smarter and started getting just certain parts of a virus, because then there's absolutely no chance that you're going to get infected with the actual virus. And so vaccines have really developed over time. And with COVID is actually a messenger RNA virus. And so what that is it's just a small little fragment of messenger RNA that gets into the outer part of the cell, doesn't enter the nucleus, doesn't interact with DNA, can't affect our genome. And it just hijacks, just like all other viruses does, it hijacks the protein-producing factory of the cell, the ribosomes, to create just a small little fragment of the spike protein. So we've all seen the picture of COVID that's got the sphere, and then it's got the little spiky projections, which are called spike proteins. Those spike proteins are what attaches to the cell and lets it in. So if we can develop an immune response to those spike proteins, that coats that, the virus isn't going to get into cells, we inactivate it, get rid of it. So messenger RNA vaccines are not a full virus particle. You cannot get an infection from the vaccine. Just creates it very specifically for that spike protein on the outside.
Well, I think what I got from that is that with it, it would make it hard for it to get into the cell, and that you're not necessarily pre-infecting me with it. Because that, I think, is a nuance that is also being missed. Can we kind of clear that part up?
Sure. So really talking about the potential of this vaccine specifically against COVID to make you ill with COVID. And like Dr. Basel pointed out, it's really, the analogy I always use is, think of the mRNA as simply a recipe from a cookbook that is being put into a cell, and some little folks inside that cell follow that recipe, and then that product is presented out to the body, and in turn, the body recognizes that as not belonging there and generates antibodies against that recipe. And so when that substance is seen again by that body, there's going to be a response to get rid of that substance. And that's the spike protein in the COVID virus, or I should say the SARS-CoV-2 virus.
And probably the biggest myth or misunderstanding about a lot of vaccines, and particularly COVID, is that because why people think that, well, I got the flu from the flu vaccine, and so the worry is I'm going to get COVID from the COVID vaccine. What you get is, like you said, the body recognizes that vaccine product as foreign and mounts that immune response. And that's what has to happen to develop that immune memory so we can fight it off later. And that immune response is what gives you the symptoms that everybody says, I got the flu from or stuff, because it's that necessary, absolutely necessary immune response that causes things like body aches and soreness at the injection site and even fevers and those sorts of things. Those are side effects, but necessary side effects of ramping up that immune response.
And I would just add too, if I could, I think people are probably familiar, maybe some of you, with the shingle shot, the annual flu shot. Those are a couple others that tend to give you that immune response, just like the COVID vaccine seems to be doing, where a lot of times we'll get a vaccine, especially as kids, and we don't even know we received it except for a shot in the arm. The three I just named do tend to cause a little bit of an immune response where you may say, geez, I got the flu from the flu shot. And no, you got your body making antibodies, and that gives you some of that feeling. And I was actually explaining that to my kids this weekend. The reason you get achy and chilled and things, that's not necessarily the virus causing the problem. That's your immune system causing you to feel that way.
So quick follow-up on that. So just, basic science that way. Why is it that our day-to-day immune system seems to be in operation that doesn't necessarily cause pain? But when we are fighting off so many greater illnesses, it can be such a significant change in our physical environment than what it would typically be, which I think is jarring for people.
So it's very similar. Almost all the symptoms we have from most illnesses actually aren't from the infection themselves, but the immune response to it, because that immune response, it's interferons and things like that. And so the bigger the threat that the body sees that infection, the more they're going to ramp up, the more interferon and all of that type of stuff that they're going to release, and the worse you're going to feel in general. And I'll also say, to your point about, kind of the others, so because of the age I am this year, you can probably figure it out. I've now, in the last 6 months, I've had my 10-year tetanus booster. I've had both shingles vaccines, influenza vaccine, and now both shots of my COVID vaccine. And the COVID vaccine, for me anyway, was pretty much the same experience that I had with, say, tetanus, about the same degree of reactivity.
So you're a pincushion at this point. You're taking a lot of those. Well, Secretary, here's the thing. There's a lot of science here, right? And we'll get into more of it as we go. How do you manage all of this science from your perspective? When we talk about it from an administrative perspective, there's a lot of different opinions out there, a lot of different ideas of what's happening, and we know there's a lot of different conflicting information. How do you vet, how do you manage all of that information as you make determinations based off?
Well, thank you for that, and thank you for the opportunity to be here remotely from here. I think from the start of this pandemic, we've really tried hard to be very transparent with both what we know and what we don't know. And of course, with COVID, a lot of things about what we know have changed. And as we have more science, guidelines have been updated, our understanding of the virus itself has really changed. And so I think we've been very palms up about that, and really tried to be a trusted source of information for folks. And again, acknowledging that what we don't know at this point. And so that's been a very conscious decision on our part. Back to the vaccine front, I think we also recognize the need to provide outreach in different ways and to address concerns that different groups might have for very real reasons. And so part of our communication strategy will be, as we have more vaccine available to be getting out on a wider basis, will really be some more communications around some of the myths and misperceptions about vaccines and COVID vaccines in this particular case. So definitely helping people understand the science and hopefully make the best decisions for themselves, which in our opinion is to be vaccinated.
If I could follow up with this, just a little bit deeper on that. When all of this information comes in, how does it get distilled? What does the team look like, right? Because I kind of imagine you sitting there reading through briefs for 48 hours at a time, but obviously that's not the case. So as that information comes in, how is your team managing that to get to the point where you can make actionable decisions?
That's a great point, and that's really been a real challenge at times with COVID, just the amount of information that's coming at us on many different fronts. So we do have dedicated team members that really do have focus areas and expertise in different areas of the response. So obviously we rely on experts like our state epidemiologist, Dr. Josh Clayton, and his team for a lot of the scientific information that's coming at us, as well as Dr. Tim Southern with our state public health lab. So I think we've got a great team that's really focused on different areas of the response to really distill a lot of that information, because there is a lot coming out. I would be lying if I told you that we don't get new information every single week, much of which is very substantive to how we will proceed in the future. And with vaccines, that's no different. That's everything from how much vaccine can we expect to different aspects of the federal government's response. And so really kind of distilling through all of that information has been an ongoing effort for us. The other thing I would hit on, though, is where I think we really shine as a state is our ability to communicate and talk through kind of what's happening with our healthcare and other stakeholder partners in this fight. And so I have the ability, I talk with Dr. Wilde and Dr. Basel on a weekly basis about, what we're hearing, kind of where we're going, what we need to pay attention to. And those are very frank conversations that, set other things aside for the good of our state's response. And I think that's a real benefit so that we have a common understanding of the information that we're hearing, and we have a, kind of a common roadmap towards those next steps, so that we can make the, hopefully have the best response possible for people in South Dakota.
Absolutely. Well, now that we know what a vaccine is, that's a pretty general term. What is the difference with this vaccine in particular? And are there any notable differences between one that people would be, for example, the flu shot, which people are most familiar with? What are some of the tangible differences that we might see there, and how is the creation of this one a bit different, if at all?
I'll take that. Dr. Basel, I think, laid out a lot of the science around, an mRNA vaccine, and but really to get to your question in regard to what's different, I think the first thing that's really different about this vaccine is how rapidly it was produced and came out, and that is not a detriment, that's actually a compliment. We were sitting here 1 year ago, if you think back to where you were on January 11th of 2020, probably not maybe hearing about COVID just a little bit. And now we're vaccinating against COVID. And I'm sitting here confidently, in my own opinion, feeling that you should have strong confidence in this vaccine and how it was manufactured, tested, and rolled out. Mm-hmm. Large clinical trials. And so just really amazing work that's gone into it. Where this vaccine is also different is really the manufacturing. This, as it was started to be looked at clinically, it was being manufactured. And that was really a big difference in regard to this vaccine. Some unknowns about the COVID vaccine is we don't know how long it's going to last. We don't know if we're going to need another shot in a year, if it's going to be lifetime. We just don't know that yet. We know it's effective once given. In fact, 95% of people that receive it are going to be immune to COVID for some time. We're hoping it's lifetime. We don't know yet. And so to me, though, that's some differences with this vaccine compared to others. What we do know, too, is this one, as Dr. Basel pointed out, is an mRNA vaccine, which requires really, really cold temperatures to store it at, and it requires 2 doses. And so it's very important as you get the first dose, you're going to be about there's going to be a 50-50 chance you're immune to COVID. As you get that second dose, that's when it pops you up to 95%. The differences right now between the 2 manufacturers, so Moderna and Pfizer, is I can't name an obvious one off the top of my head. Outside of the Pfizer vaccine requires around -80 degrees storage, Moderna -20. One's 28 days, one's 21 days. I'm not going to take a stab at which one's which because I don't want to screw it up. But you'll get your appointment when you get your first dose for your second dose. I think I'll stop there if you have further lines you want to go down.
I would like to talk about that a little bit because the speed is really interesting to me, right? Because I think from people outside of it, right, when we thought about this FDA process, it has always seemed long and arduous and expensive, and the commentary was always that that's necessary because of all the things that could go wrong. And this was at record speed. Obviously, there was a great motivation for it. But there is most people don't do things better, faster. And I think some people do have questions in terms of our global ability to do something of this complexity effectively. We're talking about things like quality control. Somebody has to manage temp. Who's managing that temp? Who's managing the load, the delivery? All of those things is changing a lot of hands. Help me get into that piece of it. And I'd love to hear from you in a second as well, Secretary, of how you feel comfortable with that entire process as it pertains to it being safe once it gets introduced into someone's body.
So probably 2 things going back to your points about, the shortened time frame. Probably the 2 biggest ways that they shorten the time frame. One is that with a regular vaccine, we would just be getting to this point in the studies showing that they were safe and effective. And then the pharmaceutical companies would say, okay, now we're going to start ramping up. Let's go look for some space somewhere to build a factory. Let's start hiring workers. Let's start gathering supplies. And that would be, a year or 2 process for them to start ramping up to do that. The big gamble that Operation Warp Speed took is we said, look, we've got to take this chance that one of these 6 or 7 vaccines at least is going to be successful. And so we're going to pay all 7 of them up front to start production now. And we hope that then at least one of them is going to prove out and we'll have vaccine ready to go. And right now we've already got the first 2. Both exceeded our wildest dreams on effectiveness and safety. And so that gamble really paid off. The other way that we've shortened it is usually we would wait even a year probably after these studies to answer those questions that you mentioned. We don't know if we're going to need to have a booster, whether, those sorts of questions, is it still transmissible, some of those questions. And so we don't have the answer to those questions today. Normally we would wait until we did, but hey, I'll take a booster in a year if I have to. It's important enough to get it. And so that's the 2 biggest ways that we short circuited.
Absolutely. Secretary, for your part, obviously the coordination of this is significant, and there are a lot of things in the transportation and the handling and the preparation that could make something that otherwise be effective ineffective. How are you managing that from a logistical perspective?
Well, you're right that there are a lot of logistical aspects that go into from manufacturing to getting shots in arms. And, I would say Operation Warp Speed, which is the federal effort to get vaccines to states, has done a very good job of helping us understand those logistics. So I think we knew going into this what would be expected in that regard. I do believe that the fact that they have to be stored in very specific ways, that we knew we wanted to see shots in arms as soon as possible and not have them sitting in freezers somewhere, really helped shape our strategy as a state to work with entities that have the capacity for those kinds of logistical challenges. And so that really led us down the path of working with the 3 large health systems as well as 2 independent health systems that just had the capacity to kind of work within those confines. We've had a great outpouring of support of people that want to help. And so on things like, how do you move vaccine from Sioux Falls to Mobridge, because that's literally one of our logistical, things that we've had to complete. The Civil Air Patrol here in South Dakota, got a hold of us, a while ago and said, hey, we have capacity in this way. We can help you with this, please. We want to be a part of it. And so that's been a great partnership as well to kind of handle some of those logistical issues. Sometimes we get questions about, can I choose to get one vaccine over the other for whatever reason? And, just with the logistics that we do have with handling and quite a bit of reporting around making sure we know where all vaccine is at any given point and that we know where it's at in its, from delivery to shots in arms. We have, very robust knowledge about that. So that makes some of those choice points a little bit different. And, we just have to kind of do what we can do with the vaccine that we have. But Operation Warp Speed, the other thing I would mention is we have a very regimented cadence in any given week. And so back to kind of those details, it's Tuesday mornings that we learn what we're going to be getting for state allocation the following week. It's Tuesday afternoons that we're talking with our phase 1 vaccination partners to say, this is what it looks like. And this is kind of how we think, it should be divvied up between all of you. Between Tuesday night and Thursday noon, we need to see a micro plan from each phase 1 vaccinator to get a sense of where they're going to further deploy it. And then we review that and we come to terms and consensus on that on Friday. And that's a weekly thing. We're ordering on Thursday nights, we're ordering on Sunday nights. And so it takes those kinds of steps that are very labor intensive for a lot of people, kind of every single day to kind of keep things moving. And so far that's worked for us. Of course, we're not seeing the kind of allocation that we are hoping to see at this point, but hopefully that will pick up and we'll be seeing even more shots in arms that way.
If I could stay with you for a little bit on this one, because, I think there's a lot of questions in this part, especially based off of what you just described. So 2 questions. One, I think just the general question is, when we think about this thing, who's in charge? Who's determining how much you get, when you get it, why this person gets it. I mean, obviously there's a lot of people at the table, but there's a lot of coordination because we are in a pandemic. You all are still managing staff realities. You're still managing the mental and emotional health of your staffs and yourselves. You're managing the actual physical care of people who had normal ailments that were just happening now. Who's in charge of this whole thing, and who ultimately is responsible for determining who gets access to this and how much?
Well, I see Dr. Basel looking my way. I would tell you, I think really from, since we've been planning around vaccines, which that planning really started in South Dakota in August. I feel like the Department of Health has really owned this. We're a centralized public health system in our state, and so that looks different than what you might see in some other states. But I think from the very beginning, we felt like it's ultimately our responsibility to make sure that we have reasonable ways for people to get vaccines. And so we haven't not shied away from that. But that's also not to say that we don't make decisions in consensus with our partners, because we're not putting shots in arms at this point anyway. And so we need to understand how things are really happening on the ground. And so just to kind of give you a sense of how we maybe developed our phase 1 population. So we've got all of phase 1, which is what we're in right now, is comprised of who we consider in South Dakota the priority populations to receive vaccine. We started kind of that decision-making process before the federal government came out with kind of their recommendations, because we knew we needed to do some thinking around this, because it really helps you then plan the logistic aspect. And so we knew right away that we needed to get to our frontline healthcare workers that are really serving patients with COVID. And I'll just give you this as an example of a decision point, because we've gotten questions about this. And as we were talking about that, in our minds, how we define that is, those are doctors and nurses for sure on those COVID units and ICU units and emergency departments, but it's also the people that are delivering meals that are coming into contact with patients. It's folks that are cleaning those units who, again, are being exposed. And so really balancing a lot of different factors to make common sense decisions in our mind. So frontline healthcare workers, long-term care workers, where we know we've seen COVID be extremely impactful in long-term care settings across the state. So, those were easy decisions about those very first groups. From there, we prioritize long-term care residents. Again, COVID's very impactful for that group because of their older age and underlying health conditions. Then from there, you start making other decisions. And so as we kind of move through those priority groups, we worked with stakeholders, including all the folks that are providing vaccines, as well as our broader healthcare community, to say, does this make sense? If you think about risks, and that we're going to have some limited supply to begin with, does it make sense to start with where we're starting? And, I think there has been consensus around that. I think the pinch point right now is that we really want to see, especially older people, folks that aren't living in long-term care facilities, but who are vulnerable to poor health outcomes, get access to that vaccine. And we're getting close to that point, and we're looking forward to that. But we really want to see more vaccine to have more robust discussions about who gets it next. But I think we've got a good plan moving forward. Ultimately, again, we've got our framework out on the web. We've got kind of a general time frame of when we expect to be able to get to different folks. All of that will change as we learn more about how much vaccine we'll be getting in the state.
Yeah.
I also wanted to bring up that, the reason I looked at you, Secretary, is you guys really did take lead from the very beginning, because it was clear back in July, August timeframe that you started pulling together all the stakeholders on a weekly basis. And so, from a state, what a wonderful government and healthcare partnership this has been as we've gone through there. And the proof is in the pudding. We're leading, in the top few states in the nation in these early days. We hit the ground running. We've gotten people vaccinated. We've gotten rid of pretty much all the vaccine that we've been delivered and stuff. And so that's to your credit.
Yeah. Well, definitely a partnership, because it takes so much to operationalize something like this. I'm personally looking forward to when we get to kind of those larger kind of community events where we have enough vaccine that we can really see a lot of people benefit from that in a short period of time. But hopefully that will be coming soon.
And I do want to touch back on that because I think a lot of people want to know a little bit more about the distribution plan and what that looks like on the grand scale. But even going back to that in general, we talked about one of the groups that we want to deal with first is elderly people and people who are immune deficient in some way. Mm-hmm. So that is an interesting point for me because the folks who you would likely have the least amount of latitude with in terms of their immune system are the ones that are on the front end of a new vaccine. And so the question I would ask you is in plain terms, is it safe and is it safe for everyone? Is it the same for folks who are pregnant? Is it safe for children? Is it safe for whatever? And what is the period that before we would really feel comfortable knowing that this is in fact what we think it is? So
to those questions in regard to its safety, I had endorsed it earlier and significant, feel very significant confidence in the safety of this vaccine. It has not been studied specifically in pregnant women, although women became pregnant during the clinical trials. Currently, the recommendation for vaccinating women in pregnancy, and I think the important point to make is that anytime you want to make a comment about perhaps the lack of safety with the COVID vaccine, you have to compare that with having COVID and the clinical effects of that and the risks that go along with that. So,
which are significant in pregnancy.
Indeed, and thanks for that clarity. Yes, absolutely. And so really the recommendation right now for a pregnant woman is to have a conversation with her healthcare provider in regard to whether the vaccine is appropriate for her right now or not. Personally, I would recommend it if someone were to come to me, just because, as Dr. Basel pointed out, the effects of COVID in pregnancy are quite significant. In regard to children, that's one where we would say, hey, let's, and thankfully, a vast majority of children do not get real ill with COVID. There are exceptions and they're tragic. But the vaccine trials did not include children. So the lowest we can go right now is 16 for I believe it's the Moderna Pfizer. Thanks. For the Pfizer product is 16 and up. We can't go lower than that until we would have federal guidance based on clinical trials with that. Otherwise, the vaccine that we have available, as we look at the clinical trials, as we look at our own experience within Sanford now, as an organization across the upper Midwest, we've given in excess of 20,000 doses. And I think we've had 15, that's 15, cases where someone has needed a higher level of care than just observation. So it's proven to be a very safe vaccine. And in terms of long-term effects from the clinical trials appears to be nothing. And so really are endorsing this as a safe vaccine.
Awesome. So as we roll into the distribution piece of it, because this is one of the things that was really interesting to me, because this is a double dose, right? If I can describe it that way. And so given that we will have some folks who have it who are 50% protected, we'll hit about 95 when they get the second one. Obviously, that's spaced out. Then we also have the actual doses that we have allotted to us or are available, any delays that are in that particular piece of it. Obviously, there has been a lot of folks who are refusing to take the vaccination, some even in the medical world. What is the virtue of a distribution plan in terms of vaccination that has the opportunity of being so uneven? What level does it need to be at? What do we need to see for it to be effective? Because ultimately, what this all comes down to is when people can see their families, when people can be with their loved ones, when people can be together again. And what is the value outside of just the health itself? What is the value of something that can be so uneven? Some have it, some have one, some have two, some don't have it at all, some are not taking it. What does that mean in real life terms?
Every vaccine we give that individual, it helps and lowers their risk of being hospitalized. I mean, we go back a couple months and both of our hospitals were bursting at the seams, and we were on the verge of having to make really difficult decisions on how are we going to care for this many people. Every person we can keep out of the hospital helps the systems, helps that individual. So at the individual level, every vaccine helps that individual and is a step forward. And so at that individual level, it's important to get it. At the population level, we've got to get to, I don't know what the magic number is, probably 70%, give or take. If we can't get to that level, sometime in the next 6 months, 9 months, whatever that is, we're going to be sitting here next Thanksgiving, and Dr. Wilde and I are going to be asking you not to get together with your family for Thanksgiving dinner again because COVID's still going to be here. If we can get enough people vaccinated, we can go back to at least some semblance of what that new normal is. Now, we don't know, will that mean, that this becomes part of the annual flu shot every year, or, is there still some low level, but, this massive problem that we have right now, got to get better. I'll give you, impact. My wife's a pulmonary and critical care physician, sees patients in intensive care unit every day. And she's made a comment several times lately that, I've seen more death and suffering in the intensive care unit these last few months than I've seen in my entire 20+ year career combined. I mean, this is so on such a different scale than anything we've ever seen before. And until we can get enough people vaccinated, it's going to stay that way.
And let me just give some space for you to add a little bit more to that, because the point was made earlier. A lot of times when we think about these type of decisions, like taking the vaccine or whatever, it's done in a vacuum, and I think a lot of people have legitimate reservations about it, but it's done in a vacuum, and it's not done with the context of what COVID does to people. Can we get an idea from a medical level, from the state level, what the real impact is at a human level? What is the story that people need to understand in terms of what this means to what's really happening? Because I don't feel like that ever comes across in a really tangible way.
Right. It's a powerful question. And number one, if I don't get a chance to thank you for the questions today, they're fantastic. And so really good job preparing and asking great questions. But getting back to the impact of vaccination versus what we're seeing, and I think that's the point I'm going to hit on again, is really anytime you make a decision regarding the COVID vaccine, it is in the setting of what COVID would do to you. And we are in a worldwide pandemic in terms of spread, severity, loss of life, utilization of resources. This is similar to the pandemic of 1918. So we are in the middle of a pandemic, and at the same time, we have this gift of our own ability to make a decision around this vaccine. And there's a lot of learned people who are really just kind of chewing on that right now and not lining up, even though their numbers up to get the vaccine. That's fine. That's fine. The slots available, and we've worked with the state, we've worked with each other in regard to those slots are still available as you kind of maybe need to process, maybe need to think about this a little bit. Just kind of look at what's going on around you. And I can imagine that if you're a person that says, maybe I've had COVID, I'll save that dose for someone else, even though it's available to me, and then maybe something within your personal circle affects you, and you say, you know what, it's my time to get vaccinated. That's fine, and things like that are going to happen. But the power of this pandemic and what it's done in regard to not only directly affecting people like Dr. Basel and his wife and myself, and a lot of us unfortunately have experienced, but there's also the indirect effects that we really see and probably I speak for myself, didn't anticipate coming into this pandemic. And that's, think of like the mental health concerns of having children not in school, having families close together all the time under very stressful circumstances, loss of job, suicide. Just within the hospital ourselves, we see a threefold increase in the number of mental health needs within our hospitalized patients. We have staff getting assaulted. We have people running around. We see abuse. We see polysubstance abuse at a level 3 times greater than before pandemic. It is a very significant time right now, and it's really a time when you have a choice to get vaccinated or not. The vaccine is safe. The vaccine is easy to get. Absolutely, please get it. If you need time to process, great. I respect that. But as your time would come, I'd really ask you to thoughtfully consider that. So I guess you had asked a little bit more of your question in regard to Secretary Malsam-Rysdon as well. So I'll just turn it over to her.
Yeah, I would just really echo what both Dr. Wilde and Dr. Basel have said so far. We are seeing really alarming trends as it pertains to, in particular, substance abuse, alcohol and other drug abuse, where we're seeing more drug overdose deaths. We think because of just the stress of the pandemic, as well as, when we're in this mode, it's harder to access treatment services and do things to stay healthy in that realm. And so there are very much, other impacts other than just getting COVID that we've had to deal with here. One of the other pitches I would like to make is, as people are considering vaccination and being vaccinated, not only is that really our best path towards a new normal, it's really, not only about weighing your own potential experience getting COVID, but really we know that COVID is spread so many times from people that never have symptoms, never know that they have COVID. So think about what you're doing on behalf of your neighbors and your family when you choose to become vaccinated and not an asymptomatic carrier. I think it's kind of easy to overlook that. And, just like we ask people to wear masks for their own safety and for the safety of others, vaccination really is a gift that you give to other people as well. At the state level, our goal is to vaccinate at least 60% of the adult population. And so we definitely hope to exceed that. If we get to that point and combined with the folks that have had COVID, then we should be starting to see that herd immunity level really, hit South Dakota and help us just kind of have that normalcy back. I know this has been super stressful for people, my own family, that I haven't been able to see as much as we would want, and want to get back to that.
To that point, let's have that part of the conversation. One of the downsides of doing things like this or moderating things like this, unfortunately, is that we have to get this giant conversation into a span of an hour. And there's so much I want to cover, but I don't want to go any further without talking about you all in this process. My day job is leadership development and culture. And those things are really big right now, especially as we talked about the things that are happening in the world right now, all of the things that are happening with people's mental health. And we know that of the top things that kill Americans, they are all exacerbated by stress. And so you all are responsible for the health and well-being. And I also don't think people really appreciate that at some point, someone is going to have to tell people it's safe. And there's a lot of liability and there's a lot of weight and gravity to that. It would be just as easy to have it be like this forever, so no one has to own what happens if you tell people to go back to normal, right? So what has that been like for you actually, for you, the human, for your teams, for the people around you, having to manage all of this information, the burden of leadership in the most extreme of cases, because I don't believe that there is a pandemic school you can go to. So what has the experience been like for you all as individuals and your teams?
Start, Dave.
Yeah. So it's been an interesting ride, especially as I talked about my wife is a pulmonary and critical care physician. I think it's been hitting her, harder, and I worry a lot more about the frontline workers that have been seeing this on such an intimate scale on a day in and day out basis. I worry about how many of those are going to burn out and we're going to lose from the practice of medicine after this is all over and everything, because this has just been unthinkable on a day-to-day basis for those individuals. And, certainly I'm still a practicing physician and everything, but, at least I'm able to take a step back from that leadership standpoint. From a leadership, there are a lot of those decisions that keep you up at night, that you keep a pen and pencil by the bedside, to try to keep track of. And, what if something unexpected does happen with this and the vaccine no longer is effective against a new strain or something? There's a lot of what ifs. And, so it's making the best decisions in the moment that you can based off of the available information and move forward. That's one thing we've learned about COVID in general, that things are so fluid and things are changing so much. I mean, if you'd had me up here last January and asked me about wearing a face mask, and I would have told you, we don't have a lot of evidence that face masks are going to help. Well, now we do, type of thing, and so what I tell you today is different than what I would have told you a year ago as we've gotten in that more evidence and stuff. And so you just have to be flexible and humble and move forward.
I would say from my standpoint, it's, I appreciate your comment. I didn't go through I missed the year of pandemic training and residency. It's how I typically answer it is it's not about me. And I think that's the way a lot of us in healthcare have felt, is this will probably be one of the greatest times for us to shine if we can step up and continue on this path. But it's the job that we do. And what I've seen is tremendous examples of people just rolling up their sleeves and, working with the state, working with each other, to know that, especially, a couple of weeks ago, how can we accommodate more patients coming to us? Because to send them somewhere else, number one, is an absolute detriment to their care. And we try to empathize with the family to say, yeah, we can't do anything here. We're going to have to send you, and it's going to be a significant distance away. How can we hold the line? Can you look at yourself in the mirror and say, that is what I accomplished during this pandemic, is I was there for my fellow humans. And those are the folks that I need to serve. And that's really the attitude that I think has kept us going. We, in our planning stages, I had a table full of mates over there that we work very closely with and continue to on a daily basis. In the spring, it was how are we going to take care of 1,000 people coming our way? Well, that number came down, thankfully, but it was still very significant. And I still don't know what the future is going to hold. But on a day-to-day basis, when one of us was not having a great day, we had a team that kind of lifted us up. And that's what it's really come down to is the healthcare teams have really kind of picked each other up, because we have to be unified, because no one asked us and no one asked you to be part of this pandemic. We're part of it. And so what are you going to do? You might be having a down day, but who's going to pick you up? Because you got to be there. And that's really what we've been focused on, what I've learned. It's not about me, it's about the people I work with, and they're great people. And so I'm curious what the secretary has to say.
Well, it's hard going after you gentlemen because I just want to say ditto. But, I think personally, I have come to appreciate our public health team in South Dakota in ways that, a pandemic just really tests your grit and your perseverance. And I would say the team at the South Dakota Department of Health has risen to that challenge time and time again. We have figured out new ways of doing things out of necessity, and really made the best out of the situation that we have. And I'm really just proud of their work, because it's a team of people that are manning phones on Sundays for the past 10 months to call people with news that they don't want to hear. And so just really, really challenging in that way. I remember some of our first discussions around, how are we going to conduct investigations and contact tracing, which are a really important part of a response like this, with literally the 20 people that we had coming into this pandemic. And at our highest peak, I think we were over 300 people needing to do that kind of work. And just really sorting through some of those things and changing in the midst of crisis is really a big challenge. And, I feel like, it's really the teamwork, keeping our eye on that bigger picture, really setting egos and the credit aside. And I think across the board in South Dakota, we've all done a really, really good job about it. It's not about those things. It's about getting the job done with so much work behind the scenes that it's just really, really hard to describe. I mean, I have a team of folks that honestly just, until very recently hadn't had a single day off in months and months and months. And that's not because they're getting paid well, they're not getting credit. It's none of that. It's because this is the work that we do. And, you step up when you need to step up. And it's been really, really heartening. And I think people in South Dakota they should feel very good about what their public health workforce and what their healthcare workforce in the general way have done so far.
Thank you. So as we land the plane, two things. One, would you all be willing to come back if we want to have a continuation to this conversation? The nature of these conversations is no one leaves satisfied. So the second thing, and maybe this is best for you, Secretary, where can people get information on distribution schedules, other FAQs, and things of that nature?
Yeah. Thank you for that plug. COVID.sd.gov. This has been an area, if you look at where we were when we started to where we're at now with just information that we hope and we think the public really finds helpful. We've come a long way in that regard and hope to see that continue well beyond COVID. But covid.sd.gov, you will see as of last week, and this is really a plug that I need to make because it's easy to see this and not appreciate how monumental this is. But you will see a map of our state that has every single county covered by one of our 5 phase 1 vaccinators. And the reason that's meaningful is because most of those entities, agreed to cover areas of the state that they don't have a presence in now. And so it's harder logistically to kind of contemplate how will I vaccinate people in that area. But again, recognizing that we have to have a strong, coordinated approach. We saw Avera and Sanford and Monument and Mobridge Regional and the Northern Plains region step up and take areas of the state so that everybody in the state has a vaccinating partner. I think that's really, really a cool thing. So interactive map, if you click on your county, you're going to see the vaccination partner for your county. In the case of Minnehaha, you have choices and luxury in that regard. But from there, you will find information, their vaccination plans, and that will continue to evolve. So check back routinely. The other tool that we put out last week is our best estimate about when we're going to get to the different priority groups in phase 1. And that's based on the allocation, the weekly allocation of vaccines that we're getting at this point. And that is subject to change, hopefully subject to change to get to groups faster as we get more vaccine. But those would be 2 resources to look at. We have a dashboard on vaccine deployment. And so as of this morning, we had about 45,700 doses in arms. And so you can always check that. That's updated on a daily basis. And so you can kind of see how we're doing and just really encourage you to look at that.
Awesome, thank you. So as Jason comes up to take us home, one thing I will remind everyone that's viewing, this is really important information, so we would appreciate it if you would share it. Make sure you follow the page, whether Rotarian or not. This is really important information. We want to make sure that you get it. And again, I'm so proud as a Rotarian to be able to participate in conversations of consequence that can help our community, both for folks who are in the state and that are out of it. So thank you all very much for joining us. We appreciate you for your time.
Let's take a moment one more time to celebrate the fact that we have our 2 hospital systems, our Secretary of Health, working together collaboratively on behalf of the citizens of South Dakota. Let's celebrate that. Thank you. Thank you all for joining us today. We will not be meeting next week. It will be Martin Luther King Day. Our next meeting will be 2 weeks from today on January 25th. It will be our mentorship summit. All Rotarians and guests will need to pre-register. It is going to be an important conversation. So please take time to join us in 2 weeks on the 25th of January. This meeting is adjourned. Thank you.
Thank you.
Boy, if we talk long enough.